So safety for healthcare workers in a lab setting, COVID-19. So what I will be discussing is what exactly is COVID-19, how infection prevention and control has to be done, what is the strategy of testing, specimen collection for testing, sample labeling, packaging, transportation, testing methods and reporting, bio-waste management. So I'll touch upon all the aspects of the lab, how they have to be taken care briefly. So what exactly is COVID? So as the name suggests, COVID is a name given recently, COVID-19. COVID stands for coronavirus in December 2019. So it's a recent name. Coronavirus is a known name. How it looks like? It's an enveloped positive sense single-stranded RNA virus named for the crown-like spikes on the surface. It has crown-like spikes which make it, which give it the name of corona. So it belongs to a family of coronavirus, and coronavirus is not new to the world. It has been coming earlier also in different forms. SARS-CoV emerged in 2003 in southern China, MERS-CoV emerged in 2012 in Saudi Arabia, and now SARS-CoV-2 emerged in December 2019 in China. This is an infectious disease caused by newly discovered coronavirus, COVID-19, declared as a pandemic by WHO in 11th March 2020. It started in December 19 in Wuhan, but the way it was spreading and it spread over to the world, that WHO had to declare it as a pandemic in March. So at this time, there is no specific vaccine, there is no specific treatment. So the only thing which we need to do is prevent the exposure to coronavirus. Incubation period is 1 to 14 days. I hope you all understand that the moment you get the infection and the period it takes to produce the symptoms is 14 days, but it can show symptoms in 5 to 6 days as well. Symptoms vary from mild to moderate to severe. So around 85% of the people have mild symptoms. They get the virus, they get cured, and there is nothing much. But around 12% to 13% of the people, they get sick to the extent of getting admitted, and around 2 to 3% are the deaths which are happening world over. Older people, people with immunocompromised state, having cardiovascular disease, diabetes, respiratory disease, they are more prone to develop serious illness. So take care of your elders in the home, and especially your workers who are senior in the lab have to take care of themselves. So there is zoonotic transmission, that means transmission from animals to human. To start with, it started from the animals only. They say that it started from the bats in China, and now from human to human, the transmission is happening. So what does it do? SARS-CoV-2 binds via its spike protein to host cell through angiotensin converting enzyme 2 and basicin. ACE2 is expressed by epithelial cells of intestine, kidney, blood vessels, most abundantly in type 2 alveolar cells of the lungs. So the moment you take it in, the first target is it goes to the lungs and it gets into the cells and starts proliferating. So once in human, the virus is transmitted mainly by direct hand-to-face contact and inhalation. So both the methods. Okay, so that is why we keep telling you that wash your hands more frequently, wash your hands repeatedly when you touch here and there, or you touch any suspected place, wash your hands. Second method, coughing and sneezing. So you have to be careful that anybody who has the infection and sneezes, the virus will come into the air, and any person who is within the area of 1 to 2 meters has a potential to get that infection. So it's very important to have coughing etiquettes. So these days we are saying that don't cough openly, you cough in your elbow. Keep your elbow in front, then cough or then sneeze, so that the aerosols don't go into the air and infect others. And they are saying that in plastic objects, it stays for a longer period. And so that is why, it is not that the moment it comes in the ear, it dies. It stays in the ear for around 3 hours. And on surfaces, it stays longer. So this is highly contagious because it is very, very virulent. Droplets typically don't travel more than 6 meters distance is okay. In air, they stay for 3 hours. Asymptomatic individuals can also be contagious. So this is very important. So you have to be careful. So you don't know the other person has virus or it doesn't have virus. Number of secondary infections generated from one infected individual is between 2 to 2.5, higher than influenza. So its virulence is 2.5 times higher than common influenza. Normal symptoms: fever, cough, shortness of breath. So shortness of breath is, one has to be little careful. If it reaches the extreme that you are finding real difficulty in breathing, contact your physician immediately. And especially as healthcare workers, you have an access to the medical officers. So don't let it go to the serious situation. So emergency warning signs are trouble in breathing, persistent pain in the chest, or confusion or inability to arouse, bluish lips or face, and other symptoms that are severe or concerning. Who is a suspected case of COVID-19? So who are the people which you have to be careful from? Any individual who's undertaken international travel in the last 14 days, but somehow now we are at a stage where for the last 14 days, there is no international travel happening because all airports and air travel is blocked. All symptomatic contacts of laboratory confirmed cases, all symptomatic healthcare personnel, all hospitalized patients with severe acute respiratory illness, fever and cough or shortness of breath, asymptomatic direct and high risk contacts of confirmed cases should be tested. So this is important. These cases should be tested on day 5 and on day 14 after the contact. This includes those who live in the same household with confirmed cases and healthcare workers who examined a confirmed case. So if you are in contact, any of you who's dealing with the COVID virus testing lab, if you are in, you don't know you're coming in contact with these patients, so you have to be careful and you have to get yourself tested if you know that you have contacted a confirmed case. So infection prevention and control. Standard precautions. So you all know that standard precautions are meant to reduce the risk of transmission of all bloodborne and other pathogens from both recognized and unrecognized sources. They are basically basic levels of infection: hand hygiene, PPE, and respiratory cuff etiquettes. So remember these 3 things. Don't forget these 3. Washing hands, using PPE, and having coughing etiquettes. So for PPE, gloves, facial protection, gown. These 3 things are must. But those people who are directly handling the samples, taking the samples, they have to wear eye cover, caps also. So another thing very important: 1 needle, 1 syringe, only 1 time. Otherwise also most of the healthcare, rather now 100% healthcare organizations are not reusing any of these things. But you have to be very careful that don't use anything to another patient. Environmental cleaning, overall housekeeping, linen, waste disposal, and patient care equipment. Everything has to be kept neat and clean. So in hand hygiene, very important. Again, most of you know that you can use either sanitizer, but if your hands are soiled, you have any blood or anything which is grossly soiled, then it is better to wash them rather than using the sanitizer. The method is the same. You put the sanitizer or the soap or liquid on your hands, rub it in a way that you cover the palms, cover the fingers, cover the nails, cover the thumb, and then the wrists, and then completely wash your hands or sanitize your hands. So these 5 places where you have to be careful, that you have to undergo hand hygiene before touching the patient, before cleaning any or doing any aseptic procedure, that means before taking the sample collection, after touching the patient, after touching any fluid or any swab, and after touching the surroundings of a known patient. 5 times hand washing is important. So before you wear your gloves for the process and after sample collection or contact with patient's skin or contact with body fluid, after removing gloves or when touching any of the blood or fluids of a patient. Especially for laboratory setting, as I told you earlier, also gloves, overall cover, goggles, N95 mask, shoe covers, and face shield. These are the PPEs to be used by the people who are exposing themselves to the positive patients. To reduce the risk, contamination of healthcare workers' hands, germ dissemination to the environment, and transmission from healthcare worker to patient and vice versa, as well as from one patient to another patient, wearing is a must. See, normally we say that gloves we are wearing to protect ourselves from the infection of the patient or from any needle prick. But here it is for both. So wear when touching the blood, body fluid, secretion, excretion, or anything of the patient. Change between the tasks on different patients. After contact with potential infectious material, so you have to change the glove. This is an important thing. After every patient who's a suspicious case, change the gloves. Remove after use and before touching the non-contaminated surfaces or before going to another patient, you have to change the gloves. And gloves for the people who are direct in touch with the patient or who are packing the material for transportation, sterile, single use, powder free, nitrile gloves. For the other cleaning staff, gloves can be heavy gloves. So cleaning means your housekeeping staff needs to wear heavy duty gloves, but people in touch will wear nitrile gloves. Facial protection, so eyes, nose, mouth. So goggles or face cover along with N95 mask. Face shield to protect mucous membrane of eyes, nose and mouth may additionally be used during the activity of taking the sample. So people want to know where to use medical mask and where to use N95. So medical masks are for all other staff who are not directly exposed to the patient. All other staff can wear surgical mask or cleaning staff can wear surgical mask. But people who are taking sample or who are doing the PCR procedure are supposed to wear respirator N95 or FFP2 or any equivalent mask. For public, CDC has given guidelines, and very beautifully I saw in their website that they are allowing people to wear homemade cloth mask also. For if you have to go out and somehow you cannot avoid crowd, you can use a homemade cloth mask also to save the surgical and N95 mask for the healthcare workers. So you can guide your family members and guide other people that everybody doesn't need to wear a surgical mask. To protect your skin and prevent soiling of clothes during activities, you have to wear gown. Remove the soiled gown as soon as possible and perform hand hygiene. Donning and doffing of PPE. Donning and doffing means how to wear PPE and how to remove PPE. So clean area of the room where the patient is, or just before the sample collection room, you should have a separate area for storing your PPE. Go in that area, sit on a clean stool, wear your foot covers, and then wear all the PPE. In case of home collection, PPE has to be worn before entering the room of the patient or suspected patient. Doffing again has to be outside the room of the patient. And when you remove all the PPE, you have to put it into the waste disposal, into the yellow bag, and put it in the waste disposal. And wherever the things are reusable, then there should be a separate bag labeled as reusable PPE bag, and put it in that so that it goes for a disinfection. So if you see this picture, first is chair and wear your shoe covers. Don't touch the floor or any other area while wearing the shoes. Disinfect your hands. Then wear gown. Fully cover torso from neck to knees, arms to end of the wrist and around the back. Fasten in the back of the neck and waist. Then wear mask. Secure ties or elastic bands at the middle of the head and neck. And some masks have elastic ear covers, so you can just slide in over the ears. Don't touch the outside of the mask. Fit the mask in a proper way so that it covers nose and mouth properly. Goggles, place over the face, eyes adjust properly. Band of the goggles should be placed over the headgear. And then wear, in the end, your hand gloves, and the hand gloves should be pulled to cover the cuff of the gown so that no is exposed. All the areas should be completely covered. So these are the methods how shoe cover has to be worn for wearing the goggles and wearing the gloves, wearing the gowns. What precautions you need to take have been depicted in this picture. So overall, what care you have to take is that don't touch the external surfaces, and when you have worn the gloves, then only start the working with the whom should we test? Lab tests can be offered when prescribed by physician as per ICMR guidelines. So word over as per CDC guidelines also, this physician has to prescribe, then only you can go for a testing. So as healthcare workers also, the moment that there is any kind of symptomology, you can go to your physician. All asymptomatic individuals who have undertaken 14 days travel, all symptomatic contacts of lab confirmed cases, all symptomatic healthcare workers, all hospitalized patients with severe respiratory illness, asymptomatic direct and high risk contacts of confirmed cases between 5th to 14th day of the contact. So as lab worker, this is an important slide for you, that who has to be tested. Who can test? Currently, ICMR has recognized the government labs. There is a list of all the government labs which are to be doing the testing for COVID, and private labs have also been taken on panel, and they are all displayed on the ICMR site, and you cannot go to any other lab. It's only on the approved labs you can go and get done. So how to collect sample? Now coming to your specific work, appropriate biosafety, biosecurity precautions must be taken while collecting the respiratory samples. A separate collection site has to be created by the lab. All private labs should preferably do home collection. So home collection is encouraged. Drive-through collection centers. A lot of labs have come up with drive-through so that patient doesn't need to get down out of his car and get exposed. So sample can be taken sitting in the car. Government ID to support the current address and contact number of the patient being tested must be collected. Sample vials have to have VTM, that is virus transport medium. This is the material which a home collection person should be carrying, or a sample packaging person should be carrying while collecting the sample. Absorbent material, leak proof secondary container. So sample will be put into a Ziploc, then another plastic bag, and see there are 3 layers, another plastic container and a bigger container. Then with the cool pack around, it has to be put in the thermocol box, and then finally into either cardboard or plastic box, whichever is your system of carrying the sample. So sample collection area has to be separate, very important. Room has to be marked clearly as biohazard signage. Alert the lab staff. If anybody is symptomatic in the lab staff, don't give him this duty of taking the samples. Prevent overcrowding. Waiting area, there should be a distance of 1 meter. Supply of masks and all E has to be regular for the healthcare workers, and biomedical waste disposal according to the guidelines. Home collection. This is a preferred method. All biosafety, biosecurity, GLP rules have to be followed. Complete donning, doffing has to be just like as I described. For home collection people also, it is just the same. So when you wear all the PPE, then go to the patient. And when you take the sample, all disposable material has to be taken with you into a double-layered yellow bag. Double-layered yellow bag should carry your material and carry that material along with back to the lab. Don't leave anything over there. Properly label, pack, and transport. All the staff should be trained for appropriate PPE, how to use, how to wear. Sample collection, handling and transportation. Documentation, how TRF has to be filled without ID and without address and particulars of the patient. You cannot give or take the sample. Good lab practices, biocontainment on spill management. So training on spill management and biomedical waste management, or accident or incident management. So these trainings should be conducted in your labs, because don't think that currently those labs which are doing the testing only need to be trained, because this illness is not the one which is going to finish by 3rd of May. This is going to carry on. So every lab, every technician has to be prepared for it. So what are the materials which you can take for sample collection? Most preferred is nasopharyngeal, oropharyngeal swab. These swabs are not ordinary cotton swabs. These swabs are Dacron polyester flock swabs. Transport them at 4 degrees centigrade within 5 days. If you have to store for more than 5 days, then -70-degree temperature. Preferably when you're taking the nasopharyngeal swab and you've taken the oropharyngeal swab also, put them in the same vial. Okay, this is important, because when both are put together, the viral load increases. Other samples which can be taken are bronchial lavage, usually in the indoor patients. Take it in the sterile container and take it to the lab within 48 hours. Tracheal aspirate, which is not very much preferred. Sputum, if sputum has to be taken, it should be deeply coughed. It should come from the lungs and not saliva. Biopsy or tissue not encouraged, that is of relevance only for autopsy samples. And serum samples. So commonly taken are nasopharyngeal, oropharyngeal swab and serum samples at 2 stages. First sample during the acute stage, and then second sample during the convalescent stage 2 to 3 weeks later. So you have to take first sample to establish the diagnosis, and second when you have to see that the infection is cleared or not. EDTA blood is not applicable, so serum has to be taken. And serum is guidance for sample collection. So as you see in the picture, for nasopharyngeal swab, tilt patient's head backwards at around 70-degree. While gently rotating the swab, insert the swab less than 1 inch into the nostril. So don't go too deep that it pains the patient. So around 1 inch you go deep, and then rotate the swab and take the swab out. Place the tip of the swab in the sterile viral medium tube and break the stick. For throat swab, take another swab. For nasal swab, both the nostrils can be taken with one swab. But for oral swab, take another fresh swab, dry swab, and as you see in the picture, use tongue depressor and touch the pharynx, avoiding the glottis so that patient doesn't gag. So you have to take the swab very carefully without giving a gag reaction to the patient by depress the tongue and then take. So sample labeling, use PP while handling specimen, seal it with absorbent material, place the vial inside a lock pouch. If available, plastic container may be used instead of a Ziploc. So it is or the protocol of your lab, you know. So Ziploc or plastic container. Then place the double Ziploc pouch in the thermocol box surrounded by hard frozen gel packs. Use hard cardboard box as the outer container and place the secondary container and the gel pack. So we are preferring here 2 Ziplocs because we don't want to give any chance of leakage of the sample. So that is the reason double Ziploc. Place the complete thing, close it, and then outside again put a Ziploc, attach a Ziploc with the documents related to the patient's ID proof and your TRF, test requisition form. So attach the label, sender's address, contact number, consignee's address, contact number, biological substance category B, UN 3373, orientation label, handle with care, hazard sticker. So biohazard sticker, handle with care, all these things should be there, especially when it is a distant transportation. So currently most of the transportation is happening on the road rather than by air because the air travel is blocked. But it is going to start soon after 3rd of May. Then you have to be very careful how the air travel has to happen and how samples will move. Labeling on the specimen, labeling on the outer container. Inside it is name, age, gender, specimen ID. Outside, name, address, and phone number. So sender has to be very careful in preparing the packet for shipment, all necessary documentation. Receiver, when reaches in the lab, acknowledge the receipt, verify number, verify name, and open in the biosafety cabinet. Now for lab, very important, everything in the biosafety cabinet. Check the specimens with the data sent. You've seen that government has not allowed, you know, the you can say rapid testing to the private labs or to the hospitals because there are so many precautions which you need to take. So if proper training is not given to everybody, the spread can be very fast. Apply acceptance and rejection criteria. Now, what are the methods? For lab people, it is very important to know that only real-time reverse transcriptase PCR, what we call as real-time RT-PCR based assay has to be recommended because it's a RNA virus. So for RNA virus, reverse transcriptase PCR is recommended because it has to be first converted into DNA before amplification. Conventional PCR and in-house real-time PCR are not recommended for COVID-19 testing. And these I have taken from guidelines from CDC and ICMR. Okay, so clearly they have mentioned about it. Interim advisory from ICMR on 2nd April, they said at hotspot areas or in containment areas, rapid antibody testing can be done, but that is only in those areas where quarantine patients are there or groups of patients are there and it is difficult to get everybody PCR done. So that government is handling by themselves. No private lab is allowed to handle rapid testing. So guidelines say that commercial kits for real-time RT-PCR based diagnosis of COVID should be FDA approved or CE certified. But currently what has happened that NIV Pune has approved certain clinics also after checking their sensitivity to 100%. So there are certain kits which are not FDA approved are also approved by Indian government or ICMR NIV Pune. So you can check all those kits from the ICMR site. So they are displayed there. Nucleic acid extraction kits and other reagents should be of standard quality. Lab staff involved in the testing should be appropriately trained in performing the PCR. Sample should be opened only in the biosafety cabinet class 2. This is important. Sample should be opened only in biosafety cabinet. Very important slide. Maintain separate areas and dedicated equipment, pipettes, centrifuge and supplies, gowns, gloves, PPE for assay reagent setup and handling of extracted nucleic acid. Workflow must be from clean to dirty area. Wear clean, disposable, unused gowns, powder-free gloves during assay and reagent setup and DNA extraction. Change gloves whenever contamination is expected. So as people know who are doing PCR, that movement is always from clean to dirty area. So first you extract nucleic acid, then everything has to be in that room, gloves, gowns, everything has to be changed, or another person has to set up the PCR, and from setting up the PCR, then it has to move to the PCR machine room. Store reagents at appropriate temperature. Keep reagents, tubes and reactions capped rather than covering with any sealing film or foil. Again important. Clean and decontaminate workplaces every 3 to 4 hours, including your pipettes. Everything has to be cleaned with 1% sodium hypochlorite. Don't bring extracted nucleic acid PCR product into assay setup area. So assay setup area has to be absolutely clean. Use positive negative controls for each run. A reporting protocol. Ensure that lab is prepared for immediate real-time reporting of the results along with contact details to ICMR headquarter database. So this site is given where every result has to go to ICMR database site. All approved labs will get a login credential from ICMR. Each lab will be given a registration number, which should be prominently exhibited in the report and in case any advertisement is made. So clearly you have to display that you are registered with ICMR to do the test along with your registration number. So no other lab can take sample, and even if other labs are taking sample, the sample will be processed only in the approved labs. So after handling the sample, DNA extraction, retain residual specimen at -70 degree. Only thaw the number of specimen extracts to be tested on that day. Don't freeze and thaw extract more than once. So once you've made the extract, only when you are testing, take out, thaw and run. Otherwise, keep it at -70. And after the testing also, keep it at 70 degree. All COVID-19 positive samples have to be transported to ICMR NIV Pune. Important for the labs who are doing, and I suppose they all know also. Under suitable biosafety and biosecurity precautions, negative samples to be destroyed within 1 week of the collection. No sample should be shared with any other organization for any purpose. So any kind of sharing has to be with the approval of NIV or see, these guidelines are important because don't think the labs which are doing will keep doing. This will travel to all other labs also. So everybody has to be prepared for doing the testing tomorrow. Bio-waste management. You all are aware of the BMW management rules of 2016. There is nothing too much different from the normal waste disposal, except that when you are handling these samples, every container where these samples are has to be separate from the rest of the waste. Every container has to be labeled properly, and report opening or operation of COVID-19 sample collection center and laboratory to concerned State Pollution Control Board. Supposing you are starting a collection center, let's say in Noida, your pollution control board should be very well aware of that a center is coming to the city. At the time of sample disposal, VTM with swabs should be discarded in a biohazard bag containing 2% Lysol or 5% freshly prepared hypochlorite solution. Bag should be sealed, again preferably if you can afford to have double bag, and should be labeled properly. Keep separate color-coded bins, bags, containers. As precautions, use double-layered bags, 2 bags for the waste collection. Collect and store waste separately prior to handling or handing over to common biomedical waste treatment plant. Use dedicated collection bins labeled as COVID-19. Dispose general waste not having contamination separately. Maintain separate record of waste generated. So all the labs normally maintain those records. How much waste you are generating, separate records have to be made, and everything has to be labeled with biohazard signage as well as label of COVID-19. Disinfect the surfaces of containers, bins, trolley storage with 1% sodium hypochlorite. And there are 2 types of surfaces, frequently used and less frequently used. So frequently used surfaces should be cleaned every 3 to 4 hours, and less frequently used like floors, roof, walls should also be cleaned once a day. And your workbenches and everything every 3 to 4 hours a day. So this is just the same as you all know. So I'll not, talk about it in detail, because you all know that human anatomical waste, which is non-glass, non-plastic waste, will go into yellow. Contaminated waste, which is all plastic, will go to red. Waste sharp and metals white. Translucent, puncture-proof or leak-proof bag or box. And all glassware into waterproof cardboard boxes, blue in colored. So this is the normal guidelines. These are various references. Please keep going to ICMR sites, NIV Pune sites, CDC sites, where every other day, every second, third day, there is upgradation of the information according to the scenario. When the things are changing, they are upgrading what has to be done now. Thank you so much. This presentation was prepared along with Vicky. And now I will hand it over to Arzoo Bhatia.
Hello, good morning, everybody. My name's Arzoo Bhatia, and my background, I've done a master's in spiritual care and psychotherapy, and I work as a psychotherapist in Canada. To start off today's presentation, I would like to start by saying thank you. I cannot imagine how hard it is to be in your shoes during this critical time in the world. But my heart is filled with prayers and joy, knowing how dedicated you all are and how selfless this act of caring for others is. I would like you to recognize it and appreciate yourselves for all the hard work you've been putting yourself through. Our focus on today's presentation is going to be mental health and COVID-19. I've mentioned some things in regards to self-care for today's focus for the rest of the presentation. I would like to start by talking about fear. I think fear is something that's very common right now. We're all feeling it. We're all feeling stressed and anxious a little bit. Fear causes stress, and stress causes decrease in mental peace and immunity. 2 things that are really important for us to have in terms of health is mental peace and immunity. So I would like to talk about how to manage fear. Some of the basic things I would like to mention is in terms of managing fear, please read and receive information from authentic sources. Please, 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 please do not depend on all the information that's going on WhatsApp, on Facebook, because they might not be from authentic sources and actually cause more stress and paranoia than they are helpful. Please refer to resources from WHO or refer to resources from government websites or any other authentic resources online. I think to manage fear, it's also very important to follow what the government is asking. There is a reason why there's a lockdown, and there's a reason why there are PPEs, and there's a reason why we need to take precautions. And I think as long as we are taking precautions and doing our best in taking those precautions, the fear would be less. And the last thing that I want to mention is self-care. I think self-care is very, very, very important in terms of mental health. So I would like to talk about self-care a little bit more. When we talk about self-care, 4 things come to mind, 4 values. The 4 values that are important is validation. Acknowledge and appreciate yourself for all the work you're doing, helping others in the midst of a global crisis. I think that's commendable and it should be appreciated, and it is. The second value I would like to mention is compassion and kindness. Recognize that you're in the midst of a pandemic and it is not easy and things are unpredictable and anxiety provoking. And so it is okay to not feel your best self. I can acknowledge that we all probably have days where we're feeling more anxious and tired and stressed, and that's okay to feel that way. The third value that's important is resilience and hope. No matter what, we will make it through. This is not going to last forever, which is good to hear and know and recognize as well. Humans are resilient creatures. We have been through wars, we've been through tortures, we've been through natural disasters in the past, and we have been through pandemics in the past. So I know the transition takes time, but I think with all the precautions that we're taking, all the information that's coming, and hopefully vaccines that will come out soon, we will make through this transition and we'll be okay. The fourth value that is really, really important is connect and communicate. I think it's important to recognize that you're loved and you're not alone. We're all going through this together. And I think it's good to acknowledge that we're all going through this together, so you don't feel isolated and alone. Some self-care tips that I want to focus on for today's presentation is 1, being consistency, routine, or ritual. So given that things are changing quickly and things are changing every day in the midst of this pandemic, things are unpredictable. We don't know what's going to happen tomorrow. We don't know what's going to happen next week. We don't know if the lockdown is going to go away. We don't know if it's going to get extended. So that unpredictability comes with anxiousness and comes with stress. Something to deal with those anxiousness feelings and stress feelings is to have consistency. What would that look like? So what 1 ritual, routine habit can you make and do intentionally that will help you feel predictable in the midst of unpredictability and fear? Some examples that I've mentioned on the slide are reading before bed, or praying before bed, or listening to your favorite song once a day while drinking something warm. All of these activities become a safe place every day, or a safe ritual every day that your body and your mental health recognizes. So it's important to have those things in order to cope better with the stress and the feelings of anxiousness. The second self-care tip that is very important is listening and sharing. Part of this webinar is to listen and share. And I think in the midst of all the exchange of information and the questions that you will have space to ask in the end would give you some sense of connection, which is important when we can feel isolated. Listening and sharing and connection also produces oxytocin in your brain, which is important because it reduces stress and it reduces your heart rate, which encourages happy emotions. So talk to each other, talk to people here on the webinar. This webinar is not only for now, for this 1 hour. You can reach out to the 360 help team later on if you have questions, if you need to reach out just to talk to somebody. You can reach out to other people attending this webinar. Reach out to your coworkers, reach out to your family members, talk to your friends. If you have a dog, talk to your dog. Sometimes that's really helpful. But I think it's important to be able to communicate your fear and stress with others so you feel less alone and less stressed. However, I think something very important is to communicate only if the other person is willing to listen. You don't want to dump your stress on somebody else, given they might already be really stressed. So it's always a better idea to take permission before we decide to share. And also encourage listening in return. I've made a whole section of this presentation for tips. You can probably see 10 self-care tips on the current slide. These tips are super simple. They don't take a lot of time. These are not like a 1 hour, 2 hour meditation thing. These are things that you can do quickly, whether you're at home, whether you're at work, whether you're anywhere else. First being take breaks. Take breaks from work, take breaks from social media, take breaks from news, take breaks from others, and take breaks from yourself. The idea of taking breaks is to give yourself peace and give yourself time to relax. A way to take break could be meditate. Meditation doesn't have to be 20 minutes long or 30 minutes long. It could just be taking 4 very intentional deep breaths, and it automatically calms your nervous system. Number 3, do a 2 or 3 or 5 minute stretch. A stiff body is a stiff mind. So what a stretch would help you do is help you flow the energy in your body into different parts and release stress. You could do yoga at home. There are a bunch of videos available on YouTube which are free, so you don't have to pay for them, which is nice. And there's yoga available for beginners, there's yoga available for anxiety, there's yoga available for stress. So I think those are just helpful resources. Number 5 is anchor and ground yourself. Something that I like to do personally is hold a cup of warm tea and notice how it feels. When I say notice how it feels, you could hold it and kind of connect with how the feeling of warmth feels in your hands, what it smells like, what it tastes like, and what it feels like when it's traveling from your mouth to your body. So again, the idea is to ground ourselves back into our body and be present with ourselves instead of racing 100 miles in the future or 100 miles into the past. It mentions chewing gum. So chewing gum is actually one of my favorite ones. It's a really easy thing. Apparently, when the body is focused on producing saliva in your mouth, it does not focus on stress as much. So chewing gum is a very easy way to de-stress yourself because your body recognizes and puts in effort to do something else versus stressing. Number 6, sing in the shower or play meditation music while in the shower. We all shower in the morning. We're all probably good at multitasking also. So I think it's, again, a really easy thing. You play meditation music in the background and you take a shower and you have yourself prepared for a good day or a better day. Read a book. For anybody who likes reading books, book could be a really good escape from everything that's going on in the world. Number 8, hug a family member or a friend. Please only hug people in your house because we are social distancing, so don't go out there hugging people. But if you are living with your family members, give them a hug, give them a very intentional hug, because hug produces serotonin and releases stress, which is really calming, something that is very useful in these times. Number 9, spend intentional time with people you love. Without having conversations about COVID-19. I know that's the topic of the year, but it could get redundant and it could get stressful for people. So I think a good way of spending intentional time with people you love would be learning a skill or learning an activity. So you could bake a cake with your children, you could play chess with your son, you could play board games as a family, or you could do whatever other exercises or skills that you do have in your family. Number 10, if you live alone, I think 1 to 6 that I mentioned in that slide are very important for you. And I think it's also important not only for people who are living alone, but for anyone, to call and text people and let them know that they matter and that you're thinking about them. And the other part to that is that if you're unable to talk to somebody else, or if you're unable to, for example, you're a doctor or you're a mental health worker or you're a physical health worker, and it's hard to sometimes, bring that stress to your family. So a really good way to kind of process your feelings or process your mental health is to write down. So you could write down notes in your phone, or you could write down in your diary about your day or about your feelings. The good part about writing your feelings or writing your thoughts down is that it helps you identify what you're feeling. Why identifying what you're feeling is important is because in psychotherapy, we use this technique called cognitive behavior therapy. Some of you might have heard of it. Cognitive behavior therapy focuses on emotions, thoughts, and behaviors. What it says is that if what you feel is what you think, and what you think is how you act. So if you're able to identify what you're feeling and what you're thinking, you're able to change how you behave. I think it's a simple concept. In the following slide, I've mentioned a reframing exercise. The exercise is actually really helpful. And I've kind of put it in a way where it focuses on the COVID crisis. So this exercise can help improve your mood by modifying your thoughts to be more balanced. When you notice you're having strong negative emotions, try to catch the thoughts that are accompanying them. Check the thoughts by taking a step back and making sure you're looking at all of the factors in the situation. It can be helpful to imagine that someone you love is having this thought. Think about what you would say to them, including the pros and cons. Finally, change or modify the original thought by making it more balanced based on the facts you've identified. Here's an example of how to use this strategy. So it's a simple strategy which talks about catch, check, and change. So catch, the initial thought, I'm not going to be able to cope during this crisis. Might be a thought that you could relate to during this time. Check the thought by looking at the facts. So the thought is, I'm not going to be able to cope during this crisis. How do you check that thought? There are real health concerns. That's true. I've managed with other difficulties in the past. Example, family illnesses, job changes. There are supports in place from our community and government to help me get through it. Change and reframe the initial thought based on the facts. So you've collected the facts when you're checking in with your thoughts. And now you have to change and reframe based on those facts that you've collected. So yes, while there are real concerns and this is a challenging time, I have coped with difficulties before in my life. And there are supports and strategies I can use to stay healthy, like physical distancing. This would be a slide that, hopefully, the 360 Help team or Mrs. Bhatia can share this PowerPoint with you, so you have these resources to reflect on and to look back at. Because I can understand this is a lot of information at one time, so that might be a bit difficult. Moving on, I would like us to do an activity together. Hopefully you guys have a piece of paper or pen or even your phone or a laptop next to you. What I want us to do is write down 3 nice things about yourself. So take a piece of paper and write down 3 nice things about yourself. It could be anything. I'm a nice person, I'm compassionate, I'm empathetic, I'm a good friend, I deal with problems really well, anything. I'm going to give you guys a minute to do that and then check in with you. I know now I can't see you all, so it's hard to tell if you guys are done writing it. Hopefully you are. Now take a minute to thank yourself for all you're doing. Again, I think gratitude is very important when you're working so hard and working so resiliently and putting yourself in situations that are a bit risky for yourself and your family members. So again, I think a reminder that I and everybody else really appreciates everything you guys are doing for your country, for your people. I would like to end on 2 notes. One being, I would like to invite everybody to share their thoughts. If you want to share about the 3 nice things you wrote about yourself, or if you have any other comments, any other questions, I would love to be able to answer some of them. The second last part of the presentation it's called, I think it's labeled Self-Care Resources, and it has a bunch of YouTube videos that I've compiled that are things that I've used in the past with other clients that have been very helpful for people. The 5-minute meditation videos, the 2-minute meditation videos, a 5-minute yoga stretch, yoga for beginners for anxiety and stress during COVID, meditation music for sleep or during the day or in the shower, and some anchoring and grounding techniques. So something again for you guys to be able to refer back to at a later point.